Don't let your examiner know I told you this. In this video, I'll be showing you possible questions you could be asked during your project defense. I'll give you the correct tips on how to tackle those questions. Project defense will be very challenging. In this video, I'll be sharing with you possible questions you're likely to be asked. That's why I said you shouldn't let your examiner know I told you this. Now, let's go back to the procedure. For chapter 1, these are the possible questions you are likely to be asked. So we'll start from chapter 1. The first question you may hear is, tell me about your topic. For illustration, I'm going to use the project I've already done. This is the project I used for my nursing council. Now, when they have asked you the first question, you say, tell me about your topic. Now, you don't just go on and say, the title of my project is Knowledge and Perception of Hypertension and Its Management among patients in Evangel's Clinic. Now, I'm using Evangel's Clinic because I don't want to use the actual name of my research setting. So I'll improvise Evangel's Clinic or my research setting. After telling your examiner your topic, you go ahead and talk about the background to your study. You don't just tell your examiner the topic and pause there waiting for the next question. Go straight to the background of the study. Like I have here now, it says hypertension is a persistent, intermittent, or sustained elevation of blood pressure, usually above 140/90 millimeter mercury, and so on and so forth. Go ahead, summarize the background to the study, and you thank me later. Another question the examiner is likely to ask me is, why did you choose this topic? So you don't have to start any Kokambu stories or maybe your previous experience about hypertension. What the examiner wants to hear from you is your statement of problem. So because you have your project with you there, just go straight to the statement of problem and describe it. Like I have here, it says, hypertension remains a leading risk factor for cardiovascular disease. Yet, awareness and understanding of its causes, consequences, and management strategies are often limited among the general population. That's all you need to say. You don't need to start telling stories of how your father suffered hypertension in the past or anything related to your family. Your examiner has no business with your past experience with hypertension. Now, you are likely to say another question. It says, what impact will this research work make? Sounds weird, right? Your examiner is indirectly asking you the significance of your study. And in nursing, you're going to tell them the significance of your study to the respondents, the nursing profession, healthcare institution, policy making, and research. These are the 5 frameworks upon which you're going to build your significance of the study. Just go straight to the point. Tell your examiner about how the research work is going to benefit the respondent, nursing profession, etc., etc. And then another question that you're likely to see from chapter 1 are your research objectives and research questions. You've got the hard copy with you there, so you can go ahead and read it. I'm going to read my own now. The first objective said is to determine the level of knowledge of hypertension among patients in the Evangel Clinic. If you have up to 10 objectives, you can list them out. The examiner is going to score you well. Stay tuned for the next episode and let me know in the comment section if there's any other topic you want me to talk about in nursing. Okay, today we're going to be talking about the possible questions you could be asked from chapter 2. Remember I said before, don't let your examiner know I told you about these questions. Now, let's look at chapter 2. The chapter 2 of your project consists of the literature review, where you talk about the conceptual review, theoretical review, and the empirical review. Most examiners won't ask you much questions on chapter 2, but here are key things you should know about your chapter 2. It could ask you where you got your literature from. And in nursing, we have many sources of literature. You can use Google Scholar, you can use PubMed, you can use Cumulative Index of Nursing and Allied Health literature. You can use so many sources of literature. It's good you go ahead to tell your examiner the particular places you got your literature from. That will help you earn more marks as you defend your project. I'll leave an info card above so you can click on it and it will take you to a video where I share tips on how to defend any presentation or project in nursing. You know, some examiners can be funny. I'm speaking from experience. The examiner can tell you to list about 5 authors he cited in chapter 2, and that is so weird. Why do I have to mention the people I cited in my chapter 2? But that's not a big deal. You did the research work yourself, so you can defend it. Now, they could also ask you questions on your theoretical review. They may tell you to describe the theory you use for this study. Go ahead, describe it, you'll get your mark. There's another question that could also come from your theoretical review, and it goes like this. It says, how does this theory conform with the present study? And when you're asked a question like this, just go ahead and tell them the application of the theory to the present study. I'll give you an illustration with the first paragraph. It says, applying the health belief model to the study of knowledge and perception of hypertension and its management among patients can offer insight into why patients may or may not adhere to recommended hypertension management practices, such as medication adherence, dietary changes, and regular monitoring. That's just it. No drama. Go straight and tell the examiner about the application of the theory to the present study. Another thing you may want to talk about is your empirical review. You did your work yourself, so you can go there and talk about maybe 1 or 2 paragraphs in your empirical review. Remember, from the last video I shared, you are advised to be as confident as possible. Once they see lack of confidence in your eyes, they will throw you off the radar. But don't be afraid. You will surely win at the end. Stay tuned for the next one and let me know in the comment section if there's any other topic you want me to discuss in nursing. Now we'll be discussing chapter 3, and the examiner should not know that I told you this about chapter 3. But let's dive into the possible questions you could be asked from chapter 3. Now, the first one is, what type of research is this? Sounds weird, right? The best way to tackle this question is to go straight to your research design. That's all your examiner wants to hear from you, your research design. There's no much drama in project defense. Just go straight to your research design. I'll read from the sample project I have here. It says, for the purpose of the study, a descriptive cross-sectional survey was used to determine the knowledge and perception of hypertension and its management among patients in Evangel's clinic. Now, if there's any other type of research design you use in your project, it's fine. Go ahead and talk about it. Let your examiners know. Remember, do it confidently. Nobody is going to eat you up in that room. Your examiners don't bite. They won't eat you up. Next question you'll be asking is, where was this research carried out? Like I said, I'm going to improvise my research setting, and I'm using Evangel's clinic. So go ahead. You have it in your go ahead. Just talk about your research setting. So because I'm using Evangel's clinic, I'm going to say this study was carried out in Evangel's clinic. Just go ahead, talk about Evangel's clinic and any other thing. You can talk about the surroundings, talk about the facilities they have in that clinic, and you're done. No much drama. You can go back to the next question. And then they ask you, who are your respondents? This means they're indirectly telling you to talk about your target population. Now, let me read from the sample project I have here. It says the study population consists of 215 hypertensive patients attending the outpatient hypertensive clinic at Evangel's clinic. That's all your examiner wants to hear about your target population. No much drama. And if they ask you how you selected your respondent, there's no big deal. Just talk about your sampling and your sampling technique. Go ahead. On my work I have here, it says a sample size of 140 was determined using the Taro-Yeman formula. Let me know in the comment section if you want me to talk about sample size determination. And then for my sampling technique, it says a sample size of 140 was selected using purposive sampling technique. Inclusion criteria were met by patients who show willingness to participate, had attended the outpatient clinic for the past 6 months, and must be physically and mentally stable to respond to these questions. If you've used other sampling techniques, it's fine. Whether I use purposive, use quota sampling, cluster sampling, or any other type of sampling technique, it's fine. Just go ahead, talk about the sampling technique, and that's all. Remember I said there's not much drama in project defense. You could also be asked this question: how did you get your data? Simple and short. If you use a questionnaire, face-to-face interview, or you're reviewing past medical records, it's fine. Just go ahead and tell your examiner about the instrument you use for data collection, and you're good. There's this fascinating question they always ask from chapter 3. It goes like this. They say, is your instrument for data collection appropriate? What they're indirectly trying to ask you is your validity and reliability of instruments. So go ahead and let your examiner know the type of validity and reliability you use. So for the work I did, I said a phase and content validity of instruments was done, and the supervisor assessed every item in the questionnaire. And after making necessary corrections, the supervisor approved the questionnaire as the working tool. Now for the reliability, I said a test-retest method was used to assess the reliability of the data collecting instrument. That will be all for chapter 3. Let me know in the comment section if there's any other topic in nursing you want me to talk about. Remember I said your examiner should not know that I told you about these questions. Now these are the questions you can see from the chapter 4. Remember chapter 4 has to do with the analysis of the data you've already collected. So watch me as I describe the kind of questions you're expected to see from chapter 4. There are not many questions on chapter 4, but it's important that you know the questions that you can see from chapter 4. The first possible question you can see here is, describe your results according to the method of data presentation. I'm going to be describing based on the type of data collection I used for my own project. And here I have it that this chapter deals with the analysis and interpretation of data collected from the respondent using a questionnaire. Remember I said that my instrument for data collection was a questionnaire. So this chapter 4 has to do with your research questions. You can't do without them. After describing the results you've gotten, you have to answer each of the research questions. Watch me as I do mine. So I'll go over to the first research question I have for this project. It says, what is the knowledge level of hypertension among patients in Evangel's clinic? Now, by describing this, you have to choose the most relevant question in a questionnaire that answers your research question. So from the list of questions I have in my questionnaire, I'm going to choose one question that I know that truly answers my research question, and that is the first one. So I'm going to describe this thoughts. It says, Table 4.2 shows that 51.6% of the respondents strongly agree that they are aware of what hypertension is, while 28.4% disagree that they are aware of what hypertension is. This is the best part of the questionnaire that describes my research question. So I'm going to tell my examiner about what I've gotten from that research question. And then I'm going to repeat the procedure for all other research questions. If I have up to 10 research questions, I'm going to describe and answer my research questions based on what I've done with my first research question. And then if you have any hypothesis that you tested in your project, go ahead and describe how you tested your own project. But for the purpose of this project, I did not test any hypothesis because it was not compulsory. That'll be all for chapter 4. You don't need any magic. There's no magic in project defense. You don't need to initiate any type of magic or drama in order to defend your project. Just go straight to the point. Nobody's going to bite you. Now we're going to go over to chapter 5, and this is the last chapter of the project. The questions are also free. So it goes like this. What did you discover from your research? So when you hear a question like this, what the examiner is indirectly asking you is your key findings, the key findings of your research. What you're trying to do is to draft it from your research questions and then align it to previous research you've cited in your empirical review. Let me give you an example. I'll still use my research question 1. That's what I'm using for these defense purposes. It says, what is the level of knowledge of hypertension among patients in Evangel's clinic? 4.2 shows that 51.6% of the respondents have adequate knowledge of what hypertension is. 43.7% of respondents strongly agree that they know the normal range of blood pressure, and 30.6 agree that they frequently monitor their blood pressure. This is in line with a study conducted in Enugu by Eze et al. 2022, which revealed similar gaps. Despite over 60% of participants recognizing hypertension as a serious health risk, fewer than 40% understood the importance of daily blood pressure monitoring or dietary control as a primary management tool. That is all you need to do. No magic, no drama. And then after this, you can go over to the next research question that you use for your project. But for the purpose of this video, I'm going to use only my first research question. And then you could ask, what does your project suggest for further study? That one is your research, so you can go ahead and read it out to your examiner. It says, a study can be conducted to assess the sustainability of lifestyle modifications and their impact on complications associated with hypertension, such as cardiovascular disease, nephropathy, and retinopathy. The present study can be repeated in another hospital using a larger population. And also, a study can be conducted to examine how cultural background and socioeconomical status influences lifestyle choices and accesses to resources for hypertension management and develop tailored intervention. That is what you need for project defense. Remember, I said you don't need much drama, you don't need to be afraid. Work in there confidently and you get the mark that you deserve. That'll be all for now. And let me know in the comment section if there is any other topic in nursing you want me to talk about.